Hello everyone. Are you worried that your child is slow or have difficulty in school? Do not worry that you are not alone. There are many parents have such difficulty. Unless until we come together and find the solution, it is not going to be get solved. So as a parent, I always thinking that I am teaching my child. But what I realized is we are learning a lot from the children, that they're also helping us to develop or grow as a parent. My name is Ganapati. I'm the head of the Occupational Therapy Department, also the head of the Pediatric Vertical of PRS Neurosciences. We have lots of parents who have a kind of social stigma that if I say my child is having some no challenges in the school or having difficulty in learning new things and facing any challenges, when it is compared to the other children, this become a stigma. So most of the time the parents do not want to seek for help. So we thought we have to give some clarity and hope for this aspect so that we can all work together and get a better result. So now, as a parent, we have to understand each children, they have their own way of learning. It may not be same for all the children, but they may learn differently. They may approach a problem differently. They may solve the problem differently. So no two children are learning in the same way. So first thing we have to understand that the child has a problem or no difficulty in learning. It is not because they're lazy, they're not interested in learning. There may be a hidden problem which is causing all these issues. So let's explore what are different kind of problems or the difficulties which the children can have, even though our children looking so normal. So there are few terminologies which I would like to bring here, because there is no way, because I have to name it for you to understand it. The first thing is intellectual disability. That is when you evaluate a person's intellectual capability through standard test. If they are falling below average or below the borderline level, this is called intellectual disability. So normally we have an IQ more than anywhere between 90-95 to 120. But when you have an IQ below that, then you called intellectually disabled children. So these children are difficult to educate them, but these children can be trainable. So based on the intellectual disability criteria, you can train them. The second category is a borderline or a slow learner. These group of people are not a intellectual disability, but they are in a borderline or below average intelligence. So such children require a different way of learning. Usually they call a slow learner. They learn slowly. They take some time to understand the concept. Sometimes the abstract concepts cannot be understood by these children. They may require a concrete examples and concrete way of teaching methods for them to understand a concept and learn. So these children are slow learners, but they may be extraordinary in the practical way of understanding the things. The third category is a learning disability. So what is the difference between this intellectual group of children and the learning disability is, this learning disability children doesn't have intellectual problems. Their intelligence is normal. That is an important point. They have only learning difficulty. So what kind of learning difficulty they can have? They can have a difficulty in reading, just reading. They may not have a problem in understanding the concept, but reading as a visual processing, they may have a problem. For example, they may have difficulty in reading the words together. So if you solve that problem for them, they may read much better. And they may have spelling reversal, or when they are writing, basically when they are seeing things, they can see reverse actually. So these are all because of their visual processing. Please understand, it is not an intellectual problem, it is a visual problem. That is why we suggest first you go to the optometrist, making sure your acuity is fine, that your vision, regular normal vision is fine, and then you have to definitely meet a specialist to understand is there a problem in the visual processing. The next category is the calculation difficulty. It's called dyscalculia, difficulty in calculation. Usually these children are basically, weaker part is the left side of the brain, which is responsible for calculation. These children can have a difficulty in adding, multiplication, learning tables. These kind of things can be a problem, but other things like science and other things, they can perform better. And definitely these are all not like one no clear cut boundaries. It's all shades, like it can be anywhere between the mild moderate to severe kind of learning difficulty. Then difficulty in writing, it's called dysgraphia, difficulty in writing. So like this you can have a different kind of learning difficulties can be there. These are all manageable if you understand the issues properly. So these are some names. There are many other categories like ADHD is another category. We can talk detail in some other topic, some other videos. But these are some of the names which for us to understand what are the signs and symptoms they can have. Now let's look at to understand what are the early signs, what you can see when the child is so young. So you can have such children be called sometimes this learning difficulty or slow learners you cannot pick up by MRI. So when you see the brain lesions, they call non-pathological lesions in the brain. That means there is no structural damage to the brain. These are all integration and the brain's processing issue. It's like a software issue, not a hardware issue. So this has to be understood functionally. So now to pick up these things earlier, you have to understand the motor milestone of your child. So we have put lots of videos on motor milestone in our YouTube channel. You can go through that and understand what are the gross motor milestone, fine motor milestone, speech milestone. So if there is any delay in such milestones, you can pick up that as a problem and you can seek for help. The other thing is difficulty in interaction, more of introvert, basically too good, like well behaved, not talking so much. This also you have to, not everybody, but some children, if they are so quiet, unusually quiet, there is something going wrong. And then if you have difficulty in recollecting things, memory issues, that can be a problem. Difficulty in handling their emotions, like they're not able to handle their emotions, very sensitive. Such children has to be paid a little more attention, and we have to handle them differently. So once you understand this, like what do you have to do? You have to understand you need help. So you may have to seek for help, and you have to meet an expert so that they can find out what is the exact concern, and they should be able to help you. At least taking an advice can change your life forever. I say that meeting an expert once can change the entire path which you take. So there are many different specialties. Basically, if you have to evaluate such children, you have trained psychologists, like the child psychologist, a clinical psychologist, or a neuropsychologist who are trained, can evaluate your child and understand what are their exact difficulties. And you can also consult an occupational therapist to understand what kind of task learning, the skill based training is required for your child, or perceptual problems, like as I told, that is it a visual perceptual problem. Sometimes they have a problem in depth, they can have a problem in precise handling things, they can have diplopia, they can have any visual problem, but you cannot pick up it in day-to-day life. And fine motor skills, handwritings, and you can have no ADL related problems, anything can be solved with the help of occupational therapist. And the physical therapist, definitely they can work on your child to, in case if you have a developmental disabilities where the child is not having adequate strength in their body, and having difficulty in doing their best, yeah, like sports, for example, sports, there is a separate subset of physical therapists pay more attention to sports rehabilitation. So these also can be considered, like when you have children with difficulty in skill learning. And the third set of professionals are speech and language specialists. Language is a crux of your intelligence. So through language you learn everything. So language specialists can help your child to get better. And then, of course, like without meeting pediatric neurologist or a developmental pediatrician, the story cannot be completed, because they're the one who going to finally diagnose the child and understand what is the overall problem. Does the child require any medical attention? Very rarely such children require medical treatment, in the sense medicines, unless until it is required, but many things can be solved with a proper approach. Now there are four stakeholders here. I have to communicate the message very clearly. Parents, teachers, the specialist who I mentioned, and the school as an environment. Now the message to the parents is, as I told, that I am learning a lot. So many times I understand, as a father, I am learning a lot, I am adapting constantly, I am correcting my behavior. So by correcting my behavior, I am correcting my child's reciprocal behavior. That is the first lesson I learned, and this I suggest everybody to follow it. And the second thing for the parents is, your child is very unique. You focus on their capability and enhance that capability, rather than focusing on their. The moment we compare the child with another child, we start paying more attention to their weakness. So enhance and encourage their strength. And the message to the teachers, I think we have to have a collaborative work between the specialist and the teachers, because it is all cross learning. The experience which the teachers has, we don't have, and the experience we have, the teacher might not have, are unlikely to have. So when we collaborate and work, you can bring lots of changes, because each child learn differently. And in your school, you can have lots of children have such difficulties. We have to develop the skill sets to pick up these children as early as possible to get the professional help. And the third population is the specialist. A specialist coming together and helping the child is going to make a huge impact than working separately. So each specialist should try to pick up these children as early as possible, going across the school, across the hospitals, and pick up these children as early as possible. As early in the sense, as early as neonatal ICU, as early as when the child born. We have to making sure everything is done. It is the responsibility of the specialist as a pediatrician, as responsibility as a neonatologist, responsibility as a developmental pediatrician, responsibility as a pediatrician, whoever is playing a role in this population. Because this attitude of let's see later is not going to help. I am serious about this. Let's see later is not going to help. Then the last group is the school. It's the school is now functioning more about the system based, and we are following a education system which is highly controversial but still producing more results. But what happens is such children learn much better in a more adaptive environment. So it is not just we have an inclusive education system, but also we have to have all the facility to address their specific individual educational needs also has to be addressed. Then only we can get a complete individual inclusive education or inclusive community for such children. My take home message for everybody is the shift has to happen from problem to potential. So instead of paying attention to their problems, start paying attention to their potential. So I just close my talk by a quote which is, the inclusion is not just placing the child in the classroom, it is ensuring they thrive in this, because it should not be a suffering for the child. They should enjoy the classroom. Thank you so much. Please subscribe this channel to your friends, so if you feel that it is very helpful for them, and also please share this video to people who need this help. Thank you so much.